If we had a semen analysis and that semen analysis showed that you have abnormally shaped sperm, can we improve that? Today we're going to talk about male fertility and how to improve the sperm count and sperm shape. Welcome to Fertile Minds. My name is Dr. Shadi Khashaba. I'm a fertility specialist at IVFAustralia. Today we're going to talk about abnormality in the sperm. And we'll talk specifically about the sperm head shape. And it's termed teratozoospermia. What exactly that means? When we look at the sperm, we like this head to be rounded with a smooth long tail. Sometimes men will have a sperm that will be abnormally shaped. Large head, tiny head, double head, no head. So is that normal? Well, actually, up to 96% of the sperm, if it looks abnormal, has double, small, large, no head, is considered normal. So we need around 4% of the sperm to be perfectly shaped. So we've got very strict criteria in choosing the sperm. Now, having less than 4% abnormality is not really an issue, as long as they're all not abnormally shaped the same. So if you've got all the sperm, they look like have large head or a tiny head, or all of them have no head, this tells us there might be some genetic issues. But they're all like different shapes, sizes, and forms. That should be fine. So you've done a semen analysis, and someone told you, you don't have enough good-looking sperm. Well, what can we do about that? Well, a few things. Well, first of all, you can actually improve your lifestyle. We know that generally, healthy body produces healthy sperm. So you start with your diet. Have healthy nutrition, full of all the ingredients of a healthy diet should have, from fats, proteins, and carbs. Exercise too. We know if you're overweight and have excess fat in your body, you have extra estrogen in your body, and that actually hampers the normal production of good sperm. So good exercise, 10 to 15 minutes, 2 to 3 times a week, that should suffice to lower your BMI and improve your sperm quality. Of course, other factors affect the sperm shape, like drinking alcohol, and what we know is excessive alcohol intake, especially binging. So if you're gonna drink, have 1 or 2 glasses a week, 1 or 2 nights a week, but not more than that. Also, smoking does affect the sperm shape and actually the swimming capacity. You know, if you say smoke marijuana, won't affect the shape, but they will make them a bit dizzy, so they won't be able to find the egg. So, healthy body, healthy sperm. If you improve all these factors, you have healthy diet, healthy exercise, you might do an ultrasound on the testes just to make sure that there's no any physical problems inside the testicle, like dilated veins that increases the temperature around the testes, so it hinders normal sperm production. Now, if at the end of the day we don't find any reason and we've got the sperm is still not improving, then we can move to certain techniques that we use in the lab that we can help you to fall pregnant at the shortest time possible. So what treatments that we can use to improve the sperm shape? Well, one of the conditions is something called varicocele, which mainly like varicose veins, but inside the scrotum, dilated veins, increases the temperature. So what we can do certain radiological kind of treatment, like an ultrasound and an X-ray, that we put just a small clips that blocks these blood vessels so they won't be too dilated. If that doesn't improve the sperm forms or shapes, then we can move to IVF treatment. Within the IVF treatments, we got more specified treatments for that suits male fertility, like ICSI, which we pick up the sperm and we pick up the eggs and we inject the sperm directly inside the egg. And that assures that we pick the best looking sperm that has the best potential to produce the best embryo inside that egg. Other techniques that we use is something called IMSI, which we even magnify the sperm instead of regular 20 to 200 times to over 2,000 times magnification. And then you can see the exact parts of the sperm and you can pick the perfect sperm for producing an embryo. And these basically are the different treatment modalities that we use to improve the sperm potential and producing a baby. Thanks again for watching, and don't forget to hit the subscribe button if you want to keep updated with the latest and greatest about fertility.